Good morning, everybody. Welcome to the July 28th, 2021 board meeting. My name is Sung-Oh, President of the board. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Governor Gavin Newsom's Executive Order N-8-21. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 2 minutes to each individual providing comments. Public comments will be limited to the agenda item being discussed at the time the lines are open for public comment. To the extent that your public comments go beyond or don't relate to the specific agenda item under discussion, I will instruct the moderator to move to the next public commenter. This approach is necessary to facilitate this meeting and to ensure that the board can get through its full agenda. I appreciate everyone's understanding and patience. I would like to ask staff moderating the meeting to provide general instructions. Moderator?
Thank you. Today, for public comment, we will be utilizing the Q&A feature within WebEx. When the president calls for public comment, I will open the Q&A feature and display the following slide for instructions for your reference. If you want to make a public comment during these times, you'll want to locate the Q&A icon on your screen. It is a question mark inside of a square. When you click on that, it will open a text box, and in that text box, you can simply type comment and submit that to all panelists. When we will be taking comments in the order that they are received, and when I call on you to make your comment, I will be requesting that you unmute your microphone. This is a new feature in our new WebEx. So when I click on your microphone to unmute it, you will get a pop-up that asks you to unmute it. You simply click the blue unmute me button, and that will open your microphone. And then once you begin speaking, your time limit of 2 minutes will begin. I will be providing a 10-second reminder when your time is about to expire. And when it does expire, I will mute your microphone and move on to the next commenter. At times during the meeting, we could get a lot of requests for comment, so I do ask that you submit only one request for comment, and then please be patient as we work through the list. For those of you new to this new version of WebEx, you may see that we have closed captioning on our screen now. For most of you, it's probably going across the bottom of your screen in a gray box. If you do not want to see this feature, you can turn it off by locating the little closed caption icon. Typically on a computer, it's in the bottom left corner of your screen. If you hover over that, it should give you the option to hide the closed captions. You can also have them reappear on your screen by following the same process. If you'd like to follow the captions by speaker, you can open the captions and highlights feature by hovering over the little robot who should be next to that closed captioning icon. And then you can click the option to view captions and highlights. That should open a box that will produce the captions in by speaker, so you can see who is saying what. And with that, I will turn the floor back over to President O.
Thank you, moderator. Can everybody hear me? Okay.
Yes, we can.
I would like to now take a roll call to establish a quorum, but before we get started, I would like to welcome our newest members, Jose de la Paz and Nicole Thibault. We are thrilled to have you both on board and looking forward to having you as a member. Members, as I call your name, please remember to open your line before speaking. Maria Serpa. We'll move on to Jig Patel.
Sorry, I was having a technological problem. I'm present. Maria.
Thank you, Maria. Jig Patel.
Good morning.
Cheryl Butler.
Good morning.
Thank you. Thank you, Cheryl. Jose de la Paz. Thank you, Jose. Shirley Kim.
Good morning.
Thank you, Shirley. Ricardo Sanchez.
Good morning, too.
Thank you, Ricardo. Nicole Thibault.
Good morning.
Good morning. And Debbie Villa.
Good morning. Debbie's here.
Thank you, Debbie. Jason Wise.
Welcome, Jose and Nicole.
Good morning, Jason, and I'm here. I apologize for everybody, but I'm having a little technical issues. I'm going to take a quick break. I apologize. Hi, moderator. Can everybody hear me okay? Thank you. Thank you, everybody. A quorum has been established. Members, we have a full agenda for our meeting over the next 2 days. I truly appreciate all of your time and commitment to the board and California consumers. I ask everyone participating today to be respectful of the work before the board today. As we begin public comment for items not on the agenda, I would like to first report back to members on an item brought to the board regarding limitations on certain medications, including hydroxychloroquine and ivermectin in the use of treatment for COVID-19. Please note that this item is not on the agenda and cannot be discussed today, but I want to report back that as directed by members at the June meeting, I have reviewed the issue with the staff and council. The board has not imposed restrictions, although I note other regulators may have taken such action. As such, we decided that assignment of this topic to a committee or further education was not necessary. Thank you, everyone. With the update provided, I will now ask the moderator to open the line for individuals to provide a public comment regarding items for potential inclusion on a future agenda. You're not required to identify yourself, but may do so. As we open the lines, I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the board and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. Moderator, please open the line for public comments.
Thank you. We've opened the Q&A panel. If you'd like to make a comment for items not on today's agenda or submit a suggestion for future meeting items, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first request comes from Sandra Martinez. Sandra, you may now unmute your line. And Sandra, we are not able to hear you. You might want to check your audio connection real quick.
Can you hear me now?
We can. Thank you.
Okay, sorry. Thank you for reviewing the restrictions on hydroxychloroquine and ivermectin, but I am confused because I know pharmacists are still not filling those prescriptions per restrictions. So I am requesting that the board remove the restrictions because apparently something is being placed on the pharmacist to not fill those prescriptions. These well-established and safe medicines are viable treatment options and well-suited for certain COVID patients, and in many cases can save lives. We know there's no treatment that's 100% effective. That's why we need these medicines. What I was going to say is totally blown now, but The reason they were being withheld, from what I can tell, was based on opinion and not science. And these opinions and medical consensus are from government agencies and those funded by government agencies, not by doctors who actually practice medicine. So you should not and need not follow guidelines that don't make sense, are unscientific, and harm people. Never before in our history has there been so much regulatory interference in the doctor-pharmacist-patient relationship, preventing physicians and pharmacists from doing proper medical care and honoring their Hippocratic oath. You have no legal authority to restrict FDA-approved medicines, and you have no authority to interfere with the medical relationship. As representative for people, you must have a moral compass to guide your decisions, no matter what outside influences you're experiencing. To deny access to these medications is cruel and immoral and has led to the needless suffering and deaths of thousands of Californians. So please stop this now and remove the restrictions. Thank you for your time.
Thank you. The next comment comes from Richard Fleming. Richard, you may now unmute your line. We can hear you.
All right, good morning. My name is Dr. Richard Fleming. I'm a PhD in physics, a nuclear cardiologist and attorney. I would like to briefly, I think, reiterate what the last person said. From a medical perspective, I think it's important that patients be allowed to receive medications based upon prescriptions provided by their physicians, absent any actual published data that shows a detrimental consequence to a treatment, including one of the medications that you don't want to specifically mention. But as far as a cardiologist is concerned, one of the medications that's an aminoquinoline has never been shown to produce polymorphic ventricular tachydysrhythmia or torsade de poids in individuals being treated for SARS-CoV-2 or the actual disease state COVID-19. It's been pretty well established from the legal perspective, both with the Griswold versus Connecticut and the Cruzen versus Director of Missouri Department of Health, that the federal government cannot intervene in the treatment of patients and that patients have an option for the treatments that they elect to have based upon an informed agreement or consent with their physician. And the Board of Pharmacy, being very sensitive to this and actually having two pharmacists that were in my medical school class back in the dark ages when I went to medical school, has a unique opportunity and responsibility to make certain that patients receive medications that physicians would provide. And so I would ask that you honor the oath that I know all of you take very seriously, as we've honored our oaths in medicine for the care and treatment of patients. Thank you so much.
Thank you. Our next comment comes from Elizabeth. Elizabeth, you may now unmute your line. We can hear you.
Okay. I have a PhD in chemical engineering, and I'm also a faculty member at a California university. And I just want to draw your attention to 3 key points regarding treatments for COVID-19. Firstly, multiple drugs that have been mentioned today have been used for treatment of many different illnesses for many years. And I just want to make that clear. They have had no ill effect, as Dr. Fleming pointed out. Secondly, the website hcqmeta.com presents meta-analyzed data for many potential treatments for COVID. And there are 265 peer-reviewed published articles on hydroxychloroquine showing 100% effectiveness for early treatment, 69% for late treatment, with a p-value of 1 in 247 trillion. So that means that it is statistically impossible for these results to be invalid or due only to chance. 60 peer-reviewed published articles on ivermectin pretty much show the same thing. Thirdly, the Swiss Policy Research Institute, where I might mention that Switzerland is quite possibly one of the best countries in the world for medical care, recommends some of the medications that have been mentioned, as well as using zinc, aspirin, vitamin D, and quercetin. Of course, for more acute cases, they also recommend heparin, fluvoxamine, and prednisone. The bottom line is that doctors should not be prevented from treating patients with therapeutics that they believe are effective, and pharmacists should not be threatened to lose their licenses for dispensing these medications under a doctor's prescription. So these are the comments I wanted to make, and I thank you for your time.
Thank you. Our next comment comes from, actually, that wraps up our comments for this round.
And thank you for the comments. Members, having received public comments, I will now take a roll call to ask members if they would like to include any item on a future agenda. Again, please remember to open your line when I call your name. We're going to start with Maria Serpa.
Nothing to add, thank you.
Thank you. Jig Patel.
Thank you.
Thank you, Jig. Cheryl Butler. Cheryl?
Okay. Yes, I'm sorry. Nothing to add based on your original comments.
Thank you, Cheryl. Jose de la Paz?
At this time.
Thank you, Jose. Shirley Kim?
Nothing to add, thank you.
Thank you. Ricardo Sanchez?
Thank you.
Thank you, Ricardo. Nicole Thibault?
Add.
Thank you, Nicole. Debbie Veal?
Hi, Song. Nope, I think you covered it before we took public comments. I think we're all good. Thank you.
Thank you, Debbie. Jason Wise?
Done.
Thank you, Jason. And I have no further comments. We're moving on to agenda item number 3, approval of board meeting minutes. Members, included in the meeting materials are draft minutes from the April 29-30, 2021, May 27, 2021, and June 17, 2021 board meetings. As we begin, I will first ask for questions or comments on the draft minutes from April 29-30, 2021 meeting. Members, when you speak, please remember to identify yourself prior to making your comments. I will also entertain a motion to approve the minutes. Members? Anyone willing to make a motion to approve?
This is Ricardo Sanchez. I'll make a motion to approve the April 29th through 30th.
Thank you, Ricardo.
And this is Debbie Veal. I will second Ricardo's motion.
Thank you, Debbie. Thank you, Ricardo. With a motion and second on the floor, I'll now open the discussion for public comment on the April 29-30, 2021 draft minutes. Moderator, please open the lines as appropriate.
This is the moderator. We've again opened the Q&A panel. If you'd like to make a comment on the April meeting minutes, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. We have a comment from Colette. Colette, you may now unmute your line. Colette, there you go. We can hear you. You remuted yourself. Again, unmute.
Oh, there we go. Can you hear
There
me?
you go. We can.
Okay. I actually tried to attend the last meeting and I am technically retarded, so I didn't get in. But I just wanted to share with you about the ivermectin thing. My daughter is a paramedic, been a paramedic for many years, and she...
Excuse me, but I think we had said at the start of the meeting we were going to try and limit public comments to the specific item that was announced. So if you would like to, you could ask the commenter whether she has comments on the minutes from the April meeting, and if not, you could move on.
I'm sorry, I couldn't get in when I tried to, so I'm sorry taking up your time.
You have to adhere to the meeting agenda. I'm sorry. If you don't have any comments related to the April 27, 2021 meeting, if you could hold off on discussion and comments, I would appreciate it. Thank you. Thanks for the comment. Any other comments?
No further at this time.
Thank you, moderator. We're moving on to the next draft minutes for our consideration are from the May 27, 2021 meeting. Members, when you speak, please remember to identify. Oh, I apologize. We're going to take a roll call vote. I'm sorry. Thank you. Let's take a roll call vote. With a motion and second and public comments, we're going to take a roll call. We're going to start with Jig Patel.
Yes.
Thank you, Jig. Cheryl Butler.
Yes.
Thank you, Cheryl. Jose de la Paz.
I abstain. I wasn't present at the meeting.
Thank you. You're going to abstain, Jose?
Yes.
Okay. Thank you. Shirley Kim.
Yes.
Thank you, Shirley. Ricardo.
Yes.
Thank you, Ricardo. Nicole.
I abstain. I also was not present at the meeting.
Sounds good. Thank you, Nicole. Debbie Beal. Thank you, Debbie. Jason Wise.
Yes.
And Maria Serpa. Thank you, Maria. I vote yes. Moving on to the next draft minutes for our consideration are from the May 27, 2021 meeting. Members, when you speak, please remember to identify yourself prior to making your comments. I will also entertain a motion to approve the minutes for April 27, 2021 meeting minutes. Members?
To approve May 27, 2021 board meeting minutes.
Thank you, Jake. Any seconds?
Ricardo Sanchez.
Thank you, Ricardo. With a motion and second on the floor, I'll now open the discussion for public comment on the May 27, 2021 draft minutes. Moderator, please open the lines as appropriate.
This is the moderator. We've again opened the Q&A panel. If you'd like to make a comment on the May minutes, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing none, would you like me to close the panel?
Yes, please. Thank you. And with a motion and second and public comment received, I will now take a roll call vote. Members, as a reminder, please open your line before voting. We're going to start with Cheryl Butler.
Abstain. I was not there.
Okay, thank you, Cheryl. Jose de la Paz.
Present.
Shirley Kim. Thank you, Shirley. Ricardo Sanchez. Thank you, Ricardo. Nicole.
Abstain.
Thank you, Nicole. Debbie Beal.
Yes.
Jason Wise.
Same.
Thank you, Jason. Maria Serpa.
Yes.
Thank you, Maria. Jig Patel. Thank you, Jig. The motion passes. Moving on to and I will vote yes. Moving on to the agenda, the final draft minutes for our consideration of June 17th, 2021 meeting. Members, when you speak, please remember to identify yourself prior to making your comments. I will also entertain a motion to approve the minutes. Members, any comments?
Song, this is Debbie.
Anyone
I
like to
would
make a
move
motion?
that we accept the June 17th, 2021 board minutes.
Thank you, Debbie. Any seconds?
Second.
Thank you, Shirley. With a motion and second on the floor, I'll now open the discussion for public comment on the June 17th, 2021 draft minutes. Moderator, please open the lines as appropriate.
This is the moderator. We've again opened the Q&A panel. If you'd like to comment on the June meeting minutes, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing no requests, would you like me to close the panel?
Yes, please. Thank you, moderator. With the motion and second and public comment received, I will now take a roll call vote. We're going to start this time with Jose de la Paz.
Present?
Thank you, Jose. Shirley Kim.
Yes.
Thank you, Shirley. Ricardo Sanchez. Thank you, Ricardo. Nicole Thibault.
I abstain.
Thank you, Nicole. Debbie Veal. Thank you, Debbie. Jason Wise.
Yes.
Thank you, Jason. Maria Serpa. Thank you, Maria. Jig Patel.
Abstain. I was absent.
Thank you, Jig. And Cheryl Butler.
Yes.
Thank you, Cheryl. And I vote yes. Motion passes. We're moving on to the agenda item 4, update from the Department of Consumer Affairs. Members, I would now like to welcome Carrie Holmes, Deputy Director of Board and Bureau Relations, to provide the board with an update from the Department of Consumer Affairs. Ms. Holmes, welcome. The floor is yours.
Thank you, Board President O. Good morning, board members and Executive Officer Ann Sodergren. I am Carrie Holmes, Deputy Director of Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me to provide a department update. I would like to welcome Jose de la Paz and Nicole Thibault as the newest members of the board. Congratulations on your appointments and thank you for your willingness to serve. With Member Thibault's appointment, the board still has 3 vacancies remaining, 2 public members and 1 licensee to be appointed by the governor. Filling current and upcoming vacancies on the Board of Pharmacy is a top priority and the process is underway. There's still room for applications. If members of the public or licensees on the call are interested in serving, please find the link titled Board Member Resources on DCA's homepage to apply for an appointment. After more than a year, COVID-19 is still affecting every aspect of our work and lives. On July 26, the governor announced enhanced safety measures for state workers and employees in healthcare settings. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing a standard to require state workers and workers in healthcare settings to either show proof of full vaccination or to be tested regularly. Workers who do not show proof of vaccination will be subject to regular COVID-19 testing and will be required to wear appropriate PPE. Questions from licensees about the healthcare worker requirements can be directed to the California Department of Public Health. Requirements for state workers are being implemented at the department level, and DCA appreciates the assistance of board staff with this effort. We will provide more detailed information as quickly as possible. We know things are moving quickly and there is a lot of information, both official and unofficial. I encourage all members and the public to visit DCA's COVID-19 webpage for updates and resources on the state's reopening plan, public health guidance, vaccinator resources, vaccine distribution, and more. DCA is receiving many questions about when and how boards will meet again in person and whether they can also continue to meet remotely. The ability of the board to meet remotely is tied to the governor's executive orders and the state of emergency. The executive order allowing remote meetings is set to expire September 30th, after which time the board will be required to follow all aspects of the Open Meetings Act, including publicly noticed and accessible locations, unless a change in law happens. I think we all recognize the value of the cost savings and increased public participation associated with remote meeting options. In the meantime, DCA will do all it can to assist boards and bureaus to transition safely to in-person meetings and will keep you informed of any changes to the meeting requirements. As a reminder, 2021 is a mandatory sexual harassment prevention training year. This means all employees and board members are required to complete the training during this year. Please also be advised that you will now access the training through the Learning Management System, which is DCA's training portal. We have created profiles for each of you in the LMS and informed your executive officer of the steps you'll need to take to log in and access the training. Board and Bureau Relations is happy to assist you with any questions or concerns you may have about LMS. Ultimately, the LMS will house your training records and may also be used to sign up for other mandatory trainings, including board member orientation training. As a reminder, newly appointed and reappointed board members are required to attend board member orientation training within a year of appointment or reappointment though we encourage you to do so as soon as possible. The next training will be held on WebEx on October 13th, so members have plenty of time to save the date. To register, please visit the DCA Board Member Resource Center at dca.ca.gov. As always, Board and Bureau Relations is here to help, and if there is anything we can do to assist, please reach out. That concludes my presentation, and I will hand it back over to Board President O.
Thank you very much, Ms. Holmes. Members, do you have any questions or comments for Ms. Holmes? If so, please remember to identify yourself before speaking. Members? Hearing none, moving on. Thank you. Moderator, please open the line for public comment for Ms. Holmes.
My apologies for the delay. I was having some challenges with my mouse. This is the moderator. We've opened the Q&A panel. If you'd like to make a comment regarding the presentation just given, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists.
We don't see anyone, so.
No, seeing no requests. Would you like me to close the panel?
Thank you, moderator. Moving on to agenda item number 5, strategic plan. Members, our next item for action is agenda item 5, discussion and consideration of the board's strategic plan. As indicated in the meeting materials, during its October 26, 27, 2016 meeting, the board approved its current strategic plan. Historically, the board has conducted an annual review of its plan. The strategic plan is intended to be a living document and updated to reflect changes in board priorities that may result from changes in the marketplace or legislation. Strategic plans are typically a 5-year plan. As included under the next agenda item, the board's strategic planning session be during the September board meeting. Provided in the meeting materials are status updates to strategic goal areas. To facilitate this discussion, I will ask each of the committee chairpersons to review their respective committee goals, as well as highlight any potential changes or priorities for the coming year. Now, I will turn the floor over to Debbie Veal, chairperson for the licensing committee. Debbie?
Thank you, Sung. The licensing committee did review our current strategic plan goals, and I believe we made one. Song, do you want me to go through each one, or can I make the assumption that people have reviewed each one of our goals? And I mean, I can go through each one and give the current update or status, or I can just kind of
I believe we can assume that people have looked at it, as we will have this full discussion in the September meeting anyway. So I think we can just assume that people have read the detail.
Okay, thank you very much. Then what I'd like to do is go to item 1.7, annual benchmarking with a national practice standard. So you'll see there that our committee looked at this, and we'd like to recommend to the board to include in its next strategic plan, incorporating a future strategic plan to focus on the elevation of various pharmacy practices and determination if the changes in the law is necessary, around the variances in practice as appropriate. So we just kind of see the practice of pharmacy is changing, and just kind of a reminder from the licensing committee that sometimes those changes require changes in regulation or statute. And so we'd like the board to make part of our goals for the next strategic plan to look at the various practices of pharmacy and see if we do need to update any of our laws. So it's kind of the background, and then in the board material is the actual recommendation.
Thank you, Debbie. So with the committee recommendation, members, do you have any comments, questions, or anything you'd like to say? Please open your line before speaking. I am not hearing anything. So with a committee recommendation, we don't need a second, so I will now open the discussion for public comment. Moderator, please open the lines as appropriate.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on the item just discussed, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And not seeing any requests at this time. Would you like me to close the panel?
Yes, please. Thank you, moderator. With a committee recommendation and public comment received, we will take a roll call vote to approve committee recommendation. We're going to start with Shirley Kim. Thank you, Shirley. Ricardo Sanchez. Thank you, Ricardo. Nicole Thibault. Nicole. We're moving on to Debbie Veal. Oh, that's okay. Thank you, Nicole.
Sorry,
go ahead.
wrong button. Yes.
Oh, thank you, Nicole. Debbie Veal?
Yes.
Thank you, Debbie. Jason Wise? Thank you, Jason. Maria Serpa? Thank you, Maria. Jake Patel? Shara Butler?
Yes.
And Jose de la Paz? Thank you, Jose. And I vote yes, motion passes. Thank you, Debbie. And I will now turn the floor over to Maria Serpa, Chairperson for the Enforcement and Compounding Committee. Maria, floor is yours.
The Enforcement Committee met on July 15th and reviewed our strategic planning goals, which there are 10, and the current goals and status are included in the meeting materials. After discussion, the committee would like to make one suggestion, mostly for clarification, to goal 2.10. That's the last goal, as you can see on the screen. It's really not to change the goal or the intent, but to clarify it. And the goal previously was written as to say, review the role and responsibility of the PIC. That did not seem to be clear to us as a committee, so we would suggest the wording changes as you see on the screen to the committee, or to the board, excuse me. To review the current status to ensure the PIC has the authority to meet the legal needs to be PIC. That's what the committee recommends.
Thank you, Maria. Members, any comments? Hearing none, with a committee recommendation, I will now open the discussion for public comment. Moderator, please open the lines as appropriate.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on the proposal before you, please click on the Q&A icon on your screen, type comment into the text field, and send that to all panelists. And seeing none, would you like me to close the panel?
Yes, please. Thank you so much. With a committee recommendation and public comment received, we're going to take a roll call vote on the committee recommendation. We're going to start with Ricardo Sanchez.
Yes.
Ricardo?
Yeah, yes.
Thank you, Ricardo. Nicole Thibault? Thank you, Nicole. Debbie Veal? Thank you, Debbie. Jason Wise?
Yes.
Maria Serpa? Jake Patel?
Yes.
Shara Butler?
Yes.
Jose de la Paz?
Yes.
And Shirley Kim. Thank you, members, and I vote yes. The committee recommendation passes. Thank you so much, Maria. The next committee for discussion is the Legislation and Regulation Committee. The meeting materials detail the updated status of the respective goals. The committee did not meet this quarter. As the chair of the committee, I believe the status updates on current goals are appropriate. Are there any comments from members? As a reminder, please remember to unmute and identify yourself before you're speaking. Members? Hearing none, I will now turn the floor over to Ricardo Sanchez, our chairperson for the Communication and Public Education Committee. Ricardo, floor is yours.
Thank you. The Communication and Public Education.
Oh, excuse me, but did we open that one up to public comment for the Enforcement Committee or for the Leg Committee?
Sure, I was gonna do that with organizational development along, but we can definitely do. Let's open that for public comment on the Legislation and Regulation Committee. Moderator?
This is the moderator. We've opened the Q&A panel. If you'd like to comment on the Leg portion of the strategic plan, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first comment comes from Stephen Gray. And Steve, you may now unmute your microphone.
Hi, this is Steve. Yeah, thank you. Thank you. This is Steve Gray. My comment goes back to the previous, for the moderator, we cannot hear here in the public the votes of each member. We hear the chair say, or the president say, thank you for your vote, but we don't hear in many cases how the individual board members actually voted. So I just wanted to make that comment before we go on with the meeting today. Thank you.
Thank you, Steve. I'm not sure why that would be happening. I'm hearing them at my end. If I could maybe just ask each of our members, when you're registering your vote, please make sure you're speaking up and close to your microphone, and let's see if that helps the situation.
Thank you for the comment, Steve. I recommend also trying to reconnect, as I had some audio problems as well. So sometimes the connection problems could cause the comment to be cut off. So we apologize, and I can hear. So if I can hear, everybody else should be able to hear. So thank you for the comments.
And I've closed the Q&A panel as well. There were no additional comments.
Thank you, moderator. We're moving on to the Ricardo Sanchez, chairperson for the Communication and Public Education Committee. Ricardo?
This is Ricardo Sanchez. The Communication and Public Education Committee reviewed the board's communication and public education strategic goals on July 14th, 2021. The committee voted to approve the following recommendations to the board. We voted to continue to pursue the board's current communication and public education strategic goals. So we went with what we have. We're happy with what we have, and I'm also assuming, like Debbie Veal, that everybody has read the the reading material, especially section 4.1 through 4.8. And with that, I hand it back to you, President. Mr. President.
Thank you, Ricardo. Appreciate it. And members, any comments or questions? Hearing none, with a committee recommendation, I will now open the discussion for public comment. Moderator, please open the lines as appropriate.
This is the moderator. We've again opened the Q&A panel. If you'd like to comment on this item, just click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing none, would you like me to close the panel?
Yes, please. Thank you, moderator. With a committee recommendation and public comment received, we're going to take a roll call vote. We're going to start with Nicole Thibault.
I abstain.
Thank you, Nicole. Debbie Veal?
I vote yes.
Thank you, Debbie. Jason Wise? Thank you, Jason. Maria Serpa? Thank you, Maria. Jit Patel? Thank you, Jig. Cheryl Butler?
Yes.
Thank you, Cheryl. Jose de la Paz?
Yeah.
Thank you, Jose. Shirley Kim? And Ricardo Sanchez? Ricardo?
Yes, I said yes, sorry. Can you hear me?
Thank you, Ricardo. And yes, we can. Thank you. And I vote yes. Motion passes. Thank you. And the final committee for discussion is Organizational Development Committee. The meeting materials detail the updates for the respective goals. I believe that the goals included are all still appropriate. Are there any comments from members? Okay, hearing none, I will open the discussion for public comment. Moderator, please open the lines as appropriate.
Again, open the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And as we wait to see if anybody has a comment, I just want to provide a gentle, brief reminder that please make sure you're muting your microphone when not speaking so that we don't get feedback. And then when you do unmute your microphone, allow just a second for that connection to happen before you begin speaking. And with that, seeing no requests for comments, would you like me to close the panel?
Yes, please. Thank you, moderator. Thank you, members. So also for our discussion today is the upcoming strategic planning session, tentatively scheduled for September 2021 meeting. As included in the meeting materials, over 2,200 stakeholders responded to the survey. Thank you to all the stakeholders for participating in the survey. Given the significant response rate, I would appreciate members' thoughts about delegating to me authority to work with staff to evaluate the information and provide recommendations that could be used to guide the discussion during the September meeting. Members, if you agree such an action is appropriate and would be helpful, I would entertain a motion. Members?
I would motion.
Thank you, Cheryl. Thank you, Ricardo. Cheryl motions, Ricardo seconds. Any other comments, members? Hearing none, with a motion and second on the floor, I'm going to open the discussion for public comment. Moderator, please open the lines as appropriate.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this proposal, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing no requests, would you like me to close the panel?
Yes, please. Thank you, moderator. With a motion and second and public comment received, I will now take a roll call vote. We're going to start with
Debbie. I just have one question for you.
Go ahead, Debbie.
I think it's great to delegate to yourself to review all the responses. I just had an idea kind of pop up in my head. Do you want to take that on, or do you want to have like the org committee review it? So it would be a couple people kind of looking at the information we received, and it's really just what's your gut? Would that be helpful to have the org committee and share the wealth?
Thank you, Debbie, for the comments. Actually, that was my original hope, but then I reached out to council and we came to a conclusion. Unfortunately, that would create a Open Meeting Act violation potentially, so we would have to have it in public. And the planning session, just to preparing the materials, we came to a conclusion it would have to be one person. That's why the delegation to me came to a conclusion. Eileen, if you want to add anything?
No, President. No, you summarized that correctly. Thank you.
Yeah, Debbie, that's why this motion became the case. So yeah, thank you for bringing that up.
Well, it just sounds like a lot of work for you. I was trying to kind of.
I know. Yes, definitely. 2,200 surveys, a lot. But thank you to everybody participating.
That's what happens to our president.
Any other comments, members, before the vote? Okay, Debbie, ready for the vote?
I am. If you're asking me, I will vote yes.
Thank you, Debbie. Jason Wise?
Yes.
Thank you, Jason. Maria Serpa? Thank you, Maria. Jig Patel? Thank you, Jig. Cheryl Butler?
Yes.
Thank you, Cheryl. Jose de la Paz?
Yes.
Thank you, Jose. Shirley Kim? Was yes, right, Shirley?
Yes.
Okay, thank you, Shirley. Ricardo Sanchez? Thank you, Ricardo. And Nicole Thibault?
Yes.
Thank you, and I vote yes. Motion passes. Thank you, everybody. And we are moving on to agenda item 6, Communication and Public Education Committee. I will now turn the meeting over to Ricardo, our chairperson of the Communication and Public Education Committee, to provide a report on behalf of the committee. Ricardo, the floor is yours.
Thank you. Moderator, can you promote Bob Davila onto to be able to assist on this?
Absolutely.
Okay, thank you.
Moderator, can you also promote Sheila? If I think she's on the list of attendees. I didn't see her on the participants.
She is. I just promoted her as well.
Also,
Okay.
this is Shirley Kim. I may need to step away from my computer momentarily.
Okay. That's fine, Kim. Okay. Good morning. I will be summarizing here the activities of the Communication and Public Education Committee at its meeting July 14th, 2021. The complete written report is in today's board meeting material, so you'll have that to refer to. First, item A is a discussion and consideration of recommended changes to the notice to consumers poster display suggested revisions to California Code of Regulations, Division 7, Title 16, Section 1707.6. Background on that, the committee is considering possible changes to the notice to consumers. The wording for the notice is specified in CCR Section 1707.6, and a copy of the current notice is in your attachment 1. At our April 29th meeting, the committee agreed on new wording known as Option 1. A copy of Option 1 is also listed as your Attachment 1. The committee recommended staff to report back with language to incorporate Option 1 into CCR 1707.6. The committee also directed staff to report back on language to modify Business and Profession Code Section 4122 and 733, which set requirements for the notice to consumers. Copies of Business and Profession Code 4122 and 733 are also on Attachment 1. At the July 14th committee meeting, staff presented language that would modify CCR 1707.6 subsection B to incorporate Option 1 into the notice to consumer. A copy of CCR 1707.6 is in your Attachment 1, which shows the proposed modifications in underline and strike-through text. Staff also recommended dropping the use of a Q&R barcode for information about interpretive services. A barcode is not technically feasible for video displays of the notice to consumers. Also, adding a tagline, talk to the expert, talk to your pharmacist. This will encourage consumers to speak with their pharmacist to prevent medication errors. Staff also presented other possible modifications to CCR 1707.6 that raise policy questions. Number one, CCR 1707.6, subsection A, requires the poster be located in a place conspicuous to and readable by prescription drug consumer. However, a notice at a pharmacy counter might not be conspicuous and readable from a drive-through window. Question, should this be revised to require placing the notice in specific locations? Number 2, CCR 1707.6 subsection C requires pharmacists to post a separate notice of interpreter services in 12 languages. Question, should this be revised to require other languages? For example, the Affordable Care Act requires Medi-Cal providers to post taglines about interpreter services in the top 16 languages spoken by non-English proficient individuals. Number 3, the new subsection D could be added to CCR 1707.6 to address information required by Business and Profession Code sections 733 and 4122. This information can be printed on a receipt instead of the notice to consumers. Question, should CCR 1707.6 be amended to add subsection D? The committee accepted staff recommendations regarding modifications to the wording of the notice to consumers posters in CCR section 1707.6 subsection B. The committee also agreed the poster should be conspicuous and readable to consumers, and the notice of interpreter services should be available in languages required for Medi-Cal providers by the Affordable Care Act. In addition, the committee agreed to add CCR section 1707.6 subsection D to address information for the notice to consumers required by Business and Profession sections 4122 and 733. The committee voted to approve the following recommendations to the board. Initiate rulemaking to amend CCR section 1707.6 as provided in the committee meeting materials. Any board member comments?
This is Jose.
Yeah, Jose.
A question. I heard the phrase barcode. Are we referencing or referring to QR coding versus barcodes? Because I'm not sure how barcodes would be scanned by a phone to display information.
Yeah, I'll have Bob Davila give you a little bit on that. Go ahead, Bob.
Good morning, committee members. Yes, Member De La Paz, that would be a QR code.
Okay. And the second question, in one of the comments, it states that barcodes would not be technically workable for pharmacies displaying the notice in a loop message. Is that? I guess I'm a little bit confused on that one because I've seen QR codes in commercials in mainstream media, and those work. So is there something unique?
I believe it would depend on how the message is displayed in a pharmacy, and that's not something that we've looked at because on initial inquiry, it was mentioned that it could be difficult to do depending on where the display is in the pharmacy, where the person is in line, sort of the layout of the actual physical layout at a pharmacy. And so we felt that it was easier just to drop that and to continue to provide information in the poster as we currently have. If the board members would like some more research or something else, we could certainly accommodate that.
Yeah, we're looking at accessibility somewhere it could the easiest way for consumers to get to.
Okay, yeah, I just saw that it stated it wasn't technically workable. So I just thought was there some challenges there? But it sounds like just accessibility for the consumer being able to access that barcode or that QR code.
Yeah, and we're you have the drive-through, you have the walk-through, walking in, and you have just different setups at different pharmacies for consumers to get their medication, and we're just trying to make it easier for them to have access to the information or have it available for them.
And
but
the next,
thank you for your comment. I appreciate it.
No problem. And then the next question, you mentioned drive-through posters. Was there a thought on, you know, a poster not being feasible by the drive-through window? What was the thought around that?
Well, the actual question was, should the language of the regulation specify where the poster should be placed? It currently does not in that subsection of 1707.6. It just says in a place conspicuous to and readable by a prescription drug consumer. And so the question arises: should the regulation be more specific and specify where it should be, or is that language something that could be interpreted to mean wherever a consumer is, whether it's in a building in front of a counter or whether it's in a vehicle in a drive-through? That was the issue.
Yeah, my thoughts would be in both, right? But okay, that answers my questions. No further questions from me.
Okay, thank you. Any other comments from board members?
Hi, Ricardo. This is Debbie. I have a couple comments and questions. First off, thank you for looking at this poster. I know I've been on the board a long time, and this was like one of the things I did at the very beginning of my service. So it was much needed, and I like the very methodical way you went about addressing it and looking at it. But I'm going to ask a couple questions based on actually what I think Jose had a couple great questions. And so my first one is I want to go back to the QR code. I understand the comments from you and Bob. So I guess you're saying it's not going to be required on the poster, but it seems like, or in the video feed, but it seems like if it's there and someone can access it, like even if it's on a video loop and maybe the TV is a little far away, but it seems like with your phone, you could potentially still, capture that QR code, and then that would take you, to the, to the poster, the information on the poster. So I guess I'm thinking, can you talk a little bit more about what would be the harm in at least having it on all the posters if people, could potentially use that as an access? I mean, in some cases, maybe it wouldn't work. Is that what you're worried about? Is that it wouldn't work?
We want to make it less confusing and more visible. So when you walk in, you from what the staff recommendation is, you'll be able to see it. We'll make sure that it's there in front of them. They can read it, and if they don't have a phone, they have they don't have to rely on someone else loaning them a phone or whatever to read a QR a barcode or anything like that. But we're open for any recommendations by the board or any way we can make this better. But this is the recommendation we got from staff, and we're just trying to work with this. And I think it's again, for the consumer, what's going to work best for them to be able to read and make sure that there's no mistakes in issuing medications.
Yeah, no, I'm totally with you on that. I'm just thinking, QR code like on the poster in the lower, like left-hand corner or whatever, might make it more accessible for some people.
Yeah, I mean,
so I'd be curious what other board members think.
Yeah, and think of,
my other question.
Go ahead.
My other question is in regard to the location. I'm looking at the revised. So I think the committee is recommending that you address it to be like in the drive-through. And so can you point out in this revised language where that changes?
Bob? Here, let's see.
I'm sorry. I'm sorry. I was having trouble with my. I was having trouble with my.
I believe that. Debbie, this is Ann. I believe that was a policy question that was presented to the committee, but I do not believe they are offering a recommendation to require it to be placed in a drive-through.
Okay. So what does that mean? That means that when an inspector goes into the store, that our policy would be that there would be something available for people in the drive-through, but we aren't specifically
Tell them where to
saying
put
this
it.
is part of 1707.6. Is that what that means?
I would ask Sheila to go ahead and describe the legal application based on the language as presented.
I was unmuted. So the question came up about the requirement is that the poster be visible, accessible, placed in a prominent position so that consumers can access it readily. And so then the question came up that, you know, there are a lot more drive-through pharmacies. So that led to the policy question of what do we do about drive-through pharmacies?
So Sheila, I thought I understood that the committee said that they wanted it to be available at drive-through, but we aren't making a change in the
Visible.
regulation. So it's just kind of more of a policy, a communication that the consumer in the drive-through should be able to see it, but we're not going to actually change anything in 1707.6. Is that correct?
Yes, that's my understanding, because the pharmacy, it's up to the pharmacy to comply. So the pharmacy has to determine, based on their policies and procedures, where to place it if they have a drive-through pharmacy. What's the most prominent, visible, accessible place for the consumer to see the poster?
So by having this wording in a place conspicuous to and readable by the prescription drug consumer, that really covers drive-through. And now we have a policy that's saying, hey, you guys, we're talking about drive-through too.
Yes. So anytime, you know, it's a touch point for consumers, basically. So if they're at the drive-through, they need to be able to see the poster.
Got it. Thank you for the clarification, and thank you very much, Ricardo, for the efforts by your committee.
I'd like to go back to, this is Sheila, and I'd like to just go back to one point on the QR code.
Yes.
So looking at the meeting materials, the QR code and the language was for translation services. The QR code that was referenced was to scan the QR code and possibly be able to see it in a different language. And that's what the committee was discussing might not be technically feasible. So it wasn't a QR code, and Bob, correct me if I'm wrong, but I didn't understand it to be a QR code where you, like a menu, you know, where you scan the QR code and you see the poster. That QR code reference was for language, right, Bob?
The QR code would be to take people using their phones to access the QR code to the not to the notice to consumers poster in their language, but to the separate poster that's referenced in 1707.6b, which lists the availability of interpretive services in 12 different languages. So it would take them to a different document, a different piece of information, not to the notice to consumers in their language.
Right, and that's what was determined by the committee to be somewhat difficult for a responsibility of the pharmacy to implement that type of technology. So it wasn't a QR code for the entire poster.
And I would remind Sheila, I'm sorry, I would remind the committee that we currently do print the poster in 5 different languages in addition to English, which are listed in the regulation. We can, you know, if the board would like to, you know, expand the types of languages and the number of languages in which the actual notice to consumer itself is printed, you know, that's certainly a discussion the board could have, but we do print it in those other languages besides English.
Sheila, thank you for that clarification.
Board member Jose De La Paz, I have a follow-up. Just for clarification, the poster, the digital poster is hosted by whom? Is it hosted, you know, by us on a website, or is it the responsibility of the pharmacist or pharmacy?
Member De La Paz, the poster itself is most pharmacies have them in their establishments. We supply them. We mail them out to pharmacists who request it, and we also have copies of the poster of the notice itself on our website. Not obviously in poster size, but they can be downloaded from our website as well.
Is there, I guess back to the QR coding, if there's a QR code placed on a poster, it should be feasible for that QR code to be scanned and it drops them into a poster in their local language. If it's hosted by us, on our website, it should be able to drop them into the 16 plus languages that are, that are available. That's QR coding. It detects the local language on the phone and it brings up the local language poster. That's straightforward from my view.
Yeah, yes, I understand what you're saying. The poster itself is actually only printed in 6 languages. This is different from the notice regarding interpretive services. That's what the QR code was intended to address, to direct consumers to that notice of interpretive services, not to the poster itself in their languages. Now, if that's something that the board would like staff to look into, we could. That's not what the intent of this was, but I just wanted to see if I can make that distinction clear.
Yeah, I guess I'm looking at the consumer journey, right? Where they start and how do they land on the next piece. If I don't understand the poster, then I don't understand the next step, right? So it's understanding the poster that leads them into their local language to consume, the additional information that they're looking for. So when you start from the, journey, that's where my question was leaning towards, I guess. So thank you for the clarification.
This is Jason. I do have a question because I guess now I'm not understanding. I thought that there was to be a QR code wherein non-English speakers would be routed to information that was essentially available on the poster to where they could understand it. So is there a QR code, and if so, where shall it drive consumers to?
Member West, again, the QR code was not intended to take consumers to the wording of the poster in their language. The QR code was intended to take consumers to the separate publication, which pharmacies are also required to have, that lists point to your language is what it's called, and it's a separate publication that says, interpretive services are available, and that phrase about interpretive services being available is printed in 12 different languages. That's a separate publication that pharmacies are required to have in their establishments. And that's what the QR code was intended to do, was to try to somehow take consumers who see this QR code on the notice to consumers to take them to the separate publication to let them know, by the way, if you need interpretive services, not just for this poster, but to conduct your business, you're entitled to have them. And that notice would be printed in 12 different languages.
Physical space shall a consumer see that notification? It is not on the poster. Where would it be?
We can certainly add that language to the poster. It's on the current poster. I think the thought was that we were trying to, when we began these discussions, we were trying to take a hard look at what information we wanted to include in the poster because we didn't want to overload it. And so we listed, as you can see in your meeting materials, the current poster has that information in there on other information being available. The current poster, that big yellow poster, says on that pill over to the left, it says interpreter services are available to you upon request at no cost. So that's in the language of the current poster.
Thank you, Bob. And I'm hearing there's some confusion among members, and I'm not sure if we have a full consensus. So I am considering, I know that we want to move forward on this, but I'm considering maybe we can send it back to the committee to clarify all these things that are being brought up.
That is fine. We basically we discussed some of this before. We sent it to the committee. All we're doing is bringing back the recommendations from our staff and also what our committee has voted on. But I'm hearing new ideas and stuff. If it's the wish of the board or any of our members to have our staff research and see how we can, add some of these items, we surely can do that. But I'd like to be specific about what you want the staff to look into also.
Because this is Song. What I'm curious is if so. There's 2 posters pharmacies are required to post. there's notice to consumers and there's a language listed so that the people can point to. Now, currently, both of them does not have a QR code, but the idea, I believe, is that the QR code somehow could be linked to the language poster. Then that would give the patients an accessibility. So, or at least if we can have a QR code on the poster that would lead them to a poster of available languages so people can see. So I think that's where we can see what technology can accomplish in terms of the QR code. And I mean, I think with prevalence of QR code these days, thanks to COVID, unfortunately, I think most people are very comfortable. So I really think that we should somehow incorporate QR codes into these posters. And I know that this takes a long process, but it's better that we get it right since we have already a poster that's out there. So I think I'm leaning toward, if the members feel comfortable, kind of sending it back to the committee. I'm looking for other members.
Yeah, Song, I would agree with you. I think, so currently there's a poster, and that's that yellow thing that's in our materials. And then the language is like an 8.5 by 11 piece of paper that's supposed to be on the counter so that the person can easily point to it. But I agree with you that, and I think even, you know, Jose and Jason also are going this way, that, you know, it'd be great to have a QR code that not only translates the poster, but, you know, when you translate the poster, then you also can translate that statement. You have the right to have this in your language. So I think that, yeah, I think the committee can tackle this and figure this out.
Yeah, I think they're great points there. I just want to be specific for Bob, so when they go back and research this, you know, we can get everything out.
I think it's a QR code, Ricardo, for both the poster and for the language thing.
Okay, I mean, it sounds like a great idea. Any other? I'm just kind of curious if there's any other board members who have any questions or concerns also.
Ricardo, this is Jig. Great comments today. I think the progress has been great. Comments from other board members and everything. I feel that to make it simple for consumer, if we have a landing page, which would have the poster, the interpretation services, and anything else we want to keep consumer updated with, that would be most ideal, rather than having a QR code just for the poster or a QR code for the language. Everything, if there's a landing page, and like Jose mentioned, if I have a specific language selected on my tablet or phone, it would directly change it to that language. And everything that I'm looking at the board pharmacy website would be in that language.
That's a good point, Jig. Thank you.
This is Sheila Tatayan. I just have a quick question for direction for the committee. So one of the policy questions related to the number of languages, because there are currently 12 languages for translation interpretive services, but with the Affordable Care Act, and Medi-Cal has implemented this because it was a requirement for Medicaid to translate into the most spoken languages. Well, the Department of Healthcare Services and the Department of Managed Healthcare have determined those languages to be 16. And I believe that was one of the policy questions, was whether to increase to the 16 languages. So then for purposes of the QR code, again, if it's a translation, do you want to go to 16 languages?
Okay.
I think for the purposes of today, if everybody is agreeable, we should consider tabling this motion from the committee, and then we can make a motion to send it back to the committee, and then research QR code issues as well as 16 languages, and then bring it back to us.
Okay. So you need a motion?
Yes, I believe so. Any other comments?
No, just one final one. You know, I just want to thank Ricardo for all the work. I know it's, you know, there's a lot of options when you look at technology to be able to tackle this. And I will be happy to assist in this discussion in the future meetings as well. And I look forward to participating in that conversation.
Yeah, thank you. We try to get things out, but as Debbie Veal pointed out, we go back and forth. The committee makes recommendations to the staff. They research stuff. They put stuff together. We bring it back. Our committee approves it. And it goes to the full board. But when we come back, we find stuff and we keep making it better for the consumers. So it's perfectly okay to keep adjusting it and keep making it better. So. We'll send it back and hope and have the staff give us a way to incorporate what's being requested by some of the board members. But thank you.
I believe a motion is needed to table. So I can make a motion to table this and send it back to the committee. But if there's any seconds.
I'll second it, son.
Thank you, Jig. So with that, I will open up for public comments. Moderator?
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing no requests, would you like me to close the panel?
Yes, please. Thank you, Ricardo. And I will. Sorry, I'm gonna step in and take a roll call if that's okay with you.
Yes, of course. Go right ahead.
All right. Thank you. With a committee so with a motion and second and public comment, I'm going to take a roll call vote, and we're going to start with Jason Wise.
Yes.
Thank you. Jason votes yes. Maria Serpa. Maria? Thank you. Maria votes yes. Jig Patel?
Yes.
Thank you. Jig votes yes. Cheryl Butler? Thank you. Cheryl votes yes. Jose de la Paz? Thank you, Jose. Jose votes yes. Shirley Kim? Shirley? Oh, sorry. Shirley stepped away.
Yes.
We're moving on to Ricardo.
Sorry. Yes.
Thank you, Ricardo. Ricardo votes yes. Nicole Thibault? Thank you, Nicole. Nicole votes yes. And Debbie Veal?
Hi, Debbie Veal votes yes.
Thank you, Debbie. And Debbie votes yes, and I vote yes. So a motion to table and send it back to the committee passes. Ricardo, back to you.
Okay, thank you. We'll just move on now to Section B, discussion and consideration of information sheet regarding possible disciplinary consequences of DUI conviction. Background. Board members have expressed concern that licensees may not appreciate the serious consequences a DUI conviction can have on their board-issued license, including possible disciplinary action. The committee asked staff to develop ways to better educate licensees about this matter that could impact their job and livelihood. At the July 14th committee meeting, staff presented information to educate licensees about the serious consequences of a DUI conviction. The information will be posted on the board's website and published in the script and any other locations directed by the board. DCA Council has reviewed and approved the DUI information. A copy is in attachment number 2 for the board members. Committee members had no comments on this information. Any board member comments right now?
I think it looks good.
So go ahead, Jose.
Just a quick question on the information that is shared currently. Is that distributed on the monthly newsletter? How's information getting to everyone.
Go ahead, Bob.
Member Del Paz, yes, we have a number of ways for disseminating information to our licensees. One is our subscriber alert system, which is email notifications that go out. Another is in our newsletter, the script, and also posting on our website, and also referencing on social media. We currently have a Twitter account.
And I assume there's text messaging and other forms of communication that could go out, in really focused around this DUI conviction and the consequences. Is there, I think what you're looking at is for a marketing campaign or a campaign to really highlight this issue. Is that what I'm getting?
We can certainly disseminate it any way the board would like. As I mentioned, we currently have these other channels, with these current channels that we use, but we're open to any other means that the board would like us to do this. We don't currently have ability to text messages individually to licensees' text numbers. We don't have that information.
Okay.
Jose, I apologize. This is Anne. I just wanted to quickly indicate that as a government agency, we are limited to some of the information that we can require people to provide to us. So if we wanted to explore some of these additional communication methods, we'll need to work with council to see whether or not the law currently as written would allow us to, collect and use those different modalities.
Correct. So I guess with the information that we're currently collecting, that's required to be maintained. If we could, I guess, focus on that to tackle this issue, I think that's a good start. And of course, looking at what other forms of media we could use.
I'd like to make a comment on this too.
Yeah, go right ahead.
Having been on the board now for 8 years, we didn't have anything out about DUI convictions. And I think I really appreciate the fact that you guys came up with this, and the fact that it's actually going to be, somewhere where members are out there where they are able to access this actually on by being in the script. I mean, it was nowhere. So the fact that we have it in 3 locations right now where members can see it, then I think this is a very good start, and I commend the committee for that.
Thank you, Cheryl. It's definitely something that we keep seeing with some of our licensees in some of our hearings. So I know that former Director Wong brought that up, and anything we can do to help any of our licensees, I think, is very welcomed. Any more comments from board members?
One last comment, and then I'll move on. Is the information sheet displayed in the break areas or anywhere in the pharmacy for the staff?
Bob, is that up to the pharmacy itself to find the location?
The board currently has no regulations or ability to require pharmacies to display this information on their premises. As far as I know, our effort is solely to get this information out to licensees via the channels that we previously mentioned.
Which is our website and
subscriber alerts, and also publication on our newsletter.
Yeah.
I guess that's something we should explore for the future, see if that would be a possibility, just like we're displaying or requiring other posters to be displayed in the premise, maybe an additional information sheet in the break area or somewhere where pharmacists or licensed individuals could visually see this on a regular basis would be useful, but I guess we could pick that up at a later state.
Yeah, Jose, and I understand what you're saying. It's just one thing that we have is our website. We could also clutter it with a lot of information. and we start losing the message. So we've gone back and forth in the past with our committee and also our board in making sure that our message was, getting out and not just all cluttered, and you have to try to somehow find it in between everything that's important up there. I mean, everything is important, but you want to get that message across. It's like naloxone and so forth. Everybody wants to put things up on the screen, and we just want to make sure that it's gets to the right individuals when they need it, and the staff it keeps improving on it. But yeah, we can explore anything. Any suggestions you guys may have are definitely welcome by this committee, and I know we have great staff that brings back their recommendations. Any more comments?
This is Maria. I'd just like to make a comment on logistics for our new members and for members of the public. The board typically spends time on communication and public education. So that's why that poster in the first one was all about patient safety and patient education. Education to our licensees are really professional responsibility. The licensees keep themselves up to date with the script and with other forms of communication. And so I think that if the board wants to consider policy changes on education to licensees, that would be a new topic and very interesting to discuss. But currently the board's policy, as I understand it, is about patient education and patient notification.
Thank you for that clarification, Maria. Thank you so much. You always bring so much knowledge to everything, or with experience. Any other comments from our board members? Hearing none, moderator, can we open up for public comments?
Open the Q&A panel. If you'd like to make a comment on this current discussion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing no requests, would you like me to close the panel?
Yes, please.
Ricardo, I'm sorry to interject. I apologize. I am going to survey members for if they need a break, as it's about 10:30, and I am foreseeing your third item might take longer than I anticipated taking a little longer. So wanting to see if we can take a break.
Definitely. What, 15 minutes? What do you want, 10 minutes?
Yeah, that would be about 10-15 minutes.
All right, 15 minutes it is. See you guys, it's 10:33,
good.
right? Or okay.
We'll see you at 10:48. All right, thank you guys.
Bye.
Hey, it's 10:48. Is everyone back? I'm gonna take a roll call. If everyone's ready, we're gonna start with Maria Serpa. Thank you, Maria. Jake Patel.
I'm here.
Thank you, Jake. Cheryl Butler. Thank you, Cheryl. Jose de la Paz.
Present.
Thank you, Jose. Shirley Kim. I think Shirley might not be back still. Moving on, Ricardo Sanchez.
Here.
Thank you, Ricardo. Nicole Thibault. Thank you, Nicole. Debbie Veal. Debbie, you back? Debbie might not be back yet. Jason Wise? Thank you, Jason. I am here. Debbie, are you back?
I see that she is still connected to the meeting. Debbie, if you're there, you are muted.
Okay, we do have a quorum, so we are going to get started. We have a lot to cover, so hopefully we'll survey if Debbie's back at some point. So, Ricardo, floor is yours.
I'm sorry, you broke up. Song, are you there?
Hi, I'm here. I'm sorry. Yeah, I'm guessing we're having some connection issues.
Okay.
So, can you hear me okay?
Yeah, we can hear you now.
Okay. All
Okay.
right.
Okay.
Go ahead, Ricardo.
I'll go ahead and continue with section C, which is our discussion and consideration of frequently asked questions regarding electronic data transmission prescriptions. A little background. Business and Professions Code Section 688 is a new law regarding electronic data transmission prescriptions. Key provisions take effect January 1st, 2022. The Enforcement Committee discussed drafting frequently asked questions, FAQs, to educate licensees about the law. The matter was referred for discussion by the Communication and Public Education Committee. Okay. At the July 14th committee meeting, staff reported a subscriber alert was issued to solicit questions from licensees for the FAQs. Staff also presented FAQs developed by supervising inspectors and reviewed by the board's executive officer and DCA counsel. Copies of the subscriber alert and FAQs are in your attachment 3 on your packet that you have. Committee discussion and recommendations. Committee members discussed how the FAQs are disseminated and how to generate more participation from licensees. Staff said that the FAQs would be disseminated through subscriber alerts, the script, and the board's website. Staff reported licensees submitted no more than 15 questions. However, the board inspectors also submitted questions based on input from licensees during inspections. More questions are expected once the FAQs are disseminated. The FAQs also have been circulated to other DCA boards that regulate prescribers for feedback. A licensee at the meeting said that the FAQs do not address an issue raised by the Business and Profession Code Section 688G regarding transferring or forwarding an electronic prescription that has not been dispensed to an alternative pharmacy. Staff has worked with DCA counsel to answer the question. The committee voted to approve the following recommendation to the board to approve the draft FAQs. Any board member comments? Hearing none. Any public comments? Moderator, can you open it up for public comments?
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. First comment comes from Lindsay Goldhorn. Lindsay, you may now unmute your microphone. We can hear you.
Great. Good morning, President and board members. This is Lindsay Goldhorn with the California Retailers Association and the National Association of Chain Drug Stores. We thank Board Member Sanchez, the Communication and Public Education Committee, and board staff for their work on the e-prescribing FAQs. CRA and NACDS are strongly supportive of e-prescribing and supported AB 2789, which was the bill passed in 2018 that enacted this law. I know that committee members are aware of this, but we just wanted to emphasize one issue we have with respect to FAQ number 5 related to BMP Code Section 688G. We are aware that this section of the BMP Code requires a pharmacy that receives an electronic prescription that has not been dispensed to transfer the prescription to a different pharmacy upon request of the patient. And we are actually okay with this requirement on principle, but we are concerned that we won't be able to comply because we don't currently have a mechanism to forward controlled substance prescriptions to another pharmacy. Current NCPDP standards only allow transfers of non-controlled substances between pharmacies. So even though we'd like to comply with the law and transferred controlled substances, we simply won't be able to because we don't have a standard from NCPDP yet. It's our understanding that NCPDP is currently working to expand the standard for the current transfer transaction to allow for the transfer of controlled substances, but the updated standard likely won't be implemented until 2024 or 2025. So there is a potential 3-year gap between the California requirement and when pharmacies will be able to comply. So I'm not sure if something can be added to the FAQs to address this since it's a statutory requirement, but I just wanted the board to be aware that pharmacies won't be able to comply until there is an approved updated NCPDP standard for controlled substance transfers. We'd be happy to work with the board to try to address this. Thanks. Let me know if you have any questions.
Thank you.
Thank you. And our next comment comes from Paige Talley. Paige, you may now unmute your line. Just as a reminder, all of our commenters today will be held to a 2-minute time limit. Paige, if you can click the unmute me button that pops up on your end. Good. Looks like you're unmuted now.
Am I unmuted?
You are. You're very quiet though, so maybe get a little closer to your microphone.
Oh, okay. Let me just turn this up higher. I only have a couple questions that shouldn't take long. Okay, can you hear me now?
We can. Go ahead.
Oh, great. Okay, Paige Talley with California Council for the Advancement of Pharmacy. And I just want confirmation that while this is a draft and you may be approving it today, we can still submit questions for the FAQs, correct?
Bob Davila.
Hey, hi, this is Eileen Smiley, but the public comment part really isn't meant to be a question and answer
We're
session.
sorry.
So if you'd like to make public comment, the board members can consider it as they consider what action to take.
Okay, so I can't ask if we can submit further questions, or do I need to rephrase that?
It's not a question and answer session. It's just give us your comments and we'll consider it in our committee.
Okay, I just am hopeful that we will be able to submit further questions for the FAQs. I guess that's it.
Thank you.
Thank you, Paige. And our next comment comes from Stephen Gray. Steve, you may now unmute your line.
Ray, just a comment about a previous comment. I'd like to point out for consideration by the committee and the board that the law does not require that the transfer of a prescription that has not been dispensed yet be done electronically. It just requires that it be transferred. And California Business and Professions Code 4052A2 allows any California pharmacist to transmit a valid prescription. And that has been used as the legal basis for decades for pharmacists to transfer prescriptions orally, for an example, by telephone or orally. That is certainly allowed for all non-controlled substance prescriptions. It is also allowed explicitly for prescriptions in schedules 3, 4, and 5 of controlled substances. And by letters already submitted to this Board of Pharmacy several years ago by, I believe, pharmacist attorney Robert Stein, the DEA has clarified that it even applies to Schedule 2. Unfortunately, the DEA did not explicitly say oral, but given the fact that pharmacies do not have yet an electronic means, then they have allowed oral transmission of yet to be dispensed Schedule 2 prescriptions. So on that basis, I think that there is not a problem with pharmacists being able to transfer a prescription that was sent to their pharmacy to another pharmacy one way or the other. Thank you very much.
Thank you, Steve. And our next comment comes from John Gray. John, you may now unmute your line.
Hi, good morning. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. Again, first I want to thank the committee for drafting these FAQs. I really believe they'll be a big help to both pharmacists and prescribers here in the state. And I also want to thank the board for considering the written comments that we provided to the board. You know, I really just want to add to both Lindsay's and Steve's comments related to the issue of the NCPP standard. And, you know, I think Steve really, gave a really good history of current law. And my only suggestion for the board to consider would be that, there's a few dozen folks listening in on this board meeting, and without kind of additional clarity that Steve highlighted in current law being present in the FAQ, I just wonder if this question of what mechanisms can or cannot be used to move an unfilled controlled substance prescription between pharmacies will not keep coming up. So the recommendation to the board would be just to consider providing more specificity, if possible, about the mechanisms allowed under current law to move controlled substance prescriptions that have not been filled yet between pharmacies. Thank you very much.
Thank you. And seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
This is Debbie. Could I perhaps make a suggestion based on the comments we received, and I'd like to have our attorney weigh in, but it seems like the request around question 5 that perhaps we can just clarify the answer a little bit better, where it says immediately transfer forward the electronic data transmission prescription to an alternative pharmacy designated by the requester via oral transmission, or if available, electronic data transmission. I mean, it seems like if we just added a little bit to this, it might just clarify it. I agree that there's only X number of people on this call, and we're trying to make this FAQ available and understandable for all. Is that,
Great.
did you guys look at that, or could we possibly make a change?
Yeah, great point, Debbie. If we can get legal to elaborate on that, that would work.
Yes.
Hi, this is Eileen. When we were considering this at the committee, it may seem easy, but some of these laws also involve DEA regs. So what we're trying to do with the FAQ is get document out there and give pharmacists some of the notification early before the effective date. We'll continue to update if we get other questions, but at this point, it may sound simple, but with respect to dealing with controlled substances, it's also dealing with the DEA regs, which we simply don't have the authority to interpret. So at this point, I think where we were at the drafting was, let's start to get the facts out, to get some of the provisions of law out, particularly what pharmacists should do if after January 1st, 2022, they don't get something via electronic prescription. And then facts are always a living document that we will consider adding to or changing as circumstance warrant.
Eileen, are you saying that the DEA only allows for, in question 5, when if a prescription hasn't been filled, the immediate transfer via electronic data?
Debbie, what I'm trying to say is that we don't have the authority to interpret DEA's rules and regs and what their policies are. So I think the author's preference when we were drafting this is to get the initial guidance out, also knowing that there are other opportunities potentially to address new questions that are frequently asked or get additional clarifications out.
I'd like to, you know what, I really have, this is Cheryl Butler, and I really have a problem with the fact that, because I can remember personally having a prescription called in by my physician and being told that it could not be transferred to another pharmacy, that the doctor had to make another call. I think this is something extremely important that we need to be able to handle as soon as possible.
I agree with you, Cheryl. I almost feel like we need to, I mean, if it's January 1st, 2022, we have another board meeting. You know, if we need to fix this, don't you think we can do that before January? I mean, what's the rush getting it out in July if we need to make it right?
Concern is we just can't. This is on. I just think the concern is we can't answer an FAQ where we cannot answer. So I think even if we give time, I feel like the conclusion is going to be the same. So that's my concern, because you know, we can say what the DEA is saying, but we can't interpret that, is my understanding. So that's a struggle. So I don't know, delaying it would actually give any clarification, but I absolutely agree with you both on the need. And I just am not sure what steps we would need to take from here. I don't know what we can do is my question. Are we just needed to try to contact the DEA maybe? Is that what we need to do? So that's where I guess we can figure out, but
Eileen, if our state law allows for us to transfer prescription either electronically or verbally, and in this situation, the technological ability to transfer it electronically is not available, and our law allows for a verbal transfer, you know, it seems like we should be able to make some sort of a statement. Because otherwise I feel like we're putting the pharmacies between a rock and a hard place.
This is Maria. I agree with where the comments are going. I think one of the issues is that this is communication and public ed, and they're putting out an FAQ on the electronic data transmission, which is one issue. What's come to light is this other gap. And I think that other gap should be looked at specifically, maybe in a different committee, to kind of look at what is the state law regulation versus DEA, and maybe come to some sort of evaluation of those issues and the gap that exist. But I'm not sure that this committee in public ed could change the FAQ and do the evaluation. I think they're kind of two separate things. I think you've identified a gap.
Is
it true that state law would not allow for the transfer by voice, but oral transfer? I mean, is it really a gap here?
Are you asking the attorney?
Yeah, I was asking Eileen.
Okay.
Sorry, Debbie, I have not looked into that specifically because we were making some determinations that answering some of this vis-a-vis state law could be more confusing if federal law is also impacted. We could take a look at that again, but I do think in some sense we need to look at the gaps between state law and federal law and where we can step in. But this was meant to be a first step to get education out to pharmacists with respect to the basic provisions of the law.
Yeah, I hope you don't mind me jumping in. The committee has offered a recommendation to approve the FAQs. So I think that there's probably going to be a motion on the table. As part of that, that may be appropriate for the board to consider if there's value in releasing at least some of the FAQs in advance, because it is intended to help guide licensees in their implementation efforts and understand potentially the rules of the road. So there may be value in at least approving a portion of the FAQs if the board determines that one question specifically requires further evaluation and assessment by council.
And would it be best reviewed in the enforcement committee as opposed
why
to
don't I try to make a motion to table the committee recommendation and adjust the motion to approve FAQ as drafted, strike out question 5, and question 5 will refer to staff in developing clarifying language once more information is available, or once the council has reviewed federal and state statutes and regulations.
I would second that.
Oh, before we go on, sorry, this is Nicole. Could I make a suggestion?
Yes, go ahead.
Would it maybe be possible to keep the question in, but put something along the lines of we're looking into this further or more to come? I think if we just exclude it entirely, it's going to cause just as much confusion. But if we let pharmacists know that we're working on it, that will help them understand that we at least understand the problem. Is that a possibility?
Point, Nicole. Yes, I agree, and hopefully we can leave the question 5 and answer would be what I was trying to state as we are reviewing federal and state regulations. Eileen, do you want to?
Make sure I understand the motion. The motion would be to release the facts with those changes that board member Bo just mentioned, and so that would be the motion, correct?
Right, we would approve FAQs for everything except we're going to leave the question 5, but the answer, we will change it to state we will be reviewing, the council will review federal and state regulations to clarify in regards to BPC section 688G. Actually, I don't want to make that narrow, so let's just say federal and state regulations.
Just that your motion be a little bit more broad and to allow the wording to be created by yourself, executive officer, and legal counsel.
That sounds great too. I hope we can combine all of that in a motion.
So
Okay.
the motion on the table, as I understand it, is to approve the FAQs as drafted. However, to further refine the response to question 5 at the direction of the board president in consultation with board staff and council. Is that the correct motion?
Anne always comes up with a perfect way to state our motions. Absolutely, yes. I will seek seconds.
No, I was just going to clarify if the second is agreeable to that amendment to the motion.
But do we need to put into that motion per Nicole's comment that we're actually going to add wording to question 5 that it's under further review?
Yeah, Debbie.
Okay. So we're gonna approve the FAQs as presented with addition to question 5. A sentence added that, you know, I don't know what the sentence is, but
Right.
we know the
Right.
intent of the
Answer to
sentence.
question 5 will be what Anne was referring to.
Okay, but we're not approving as presented because we are going to make a change to question 5.
No. Yeah. No. Yeah.
Okay.
Okay.
But
So
just to clarify, I think Debbie, I think like we've done in the past is we don't need to have this come back to us to be reapproved. We're approving it with the policy such that the president and legal counsel will make the wording state the intent of our discussion.
No, I'm not arguing with that, Anne. I mean, sorry, Maria. I'm arguing with that we are not approving it as presented because we actually are approving it with the change. We're going to actually put a sentence in here that's going to be evaluated. And then we are also saying that evaluation can happen by the board president with counsel and staff. But, you know, all that's not going to be part of question 5. But we need to put, I agree with Nicole, we need to put a little sentence in there that is under evaluation.
yes, because to me it
And
sounds
Cheryl, are you
still.
agreeable to the second?
Well, that's why I was trying to really understand what was going to be added there, because as it is written there is like this is something that can be done when in fact you go into a pharmacy and it can't be done.
Right.
So just,
Right, yeah.
this is
Okay.
Jose, just a question. There was a motion made, there was a motion second. And am I hearing that then Nicole is the friendly amendment that's being made? And there's a new motion that's being amended, or the motion is being amended by the first individual made the motion. So that needs to be seconded by the individual that seconded the motion originally, is that correct?
Yeah, Cheryl, I'm trying to confirm with Cheryl if she's okay with the motion. Seconding.
Got it. Okay, I just wanted to clarify, just so I follow along.
Again, I'm just trying to hear I'm trying to understand what you added to so that it's still not confusing when pharmacists see this, and the pharmacist, according to what this says, I can transfer a prescription, but then I really can't. So I'm still not understanding what you guys are going to put there to clarify.
And okay, and do you mind
So let
restating the motion?
Is approve the FAQs with the inclusion of refinement to FAQ number 5 to refine the language to have the board president with counsel and staff to refine the language in question number 5 to state the intent of the board's discussion.
Okay, I can second that.
Okay, thank you, Cheryl, and thank you, everybody. Go ahead.
I was going to say, we're not really saying that we're putting in, further review is being added to question 5. I know we're doing it, but I think we do need to make a statement in there in case someone actually looked at this and is confused, just like, we are. But I think that is what we're doing, right? We're adding a statement in the answer part that it's under further evaluation.
That is my understanding.
Okay. Thank you.
Are we on the same page, Ann and I?
And the motion, the board president, along with counsel and staff, will be refining the language in question 5 to incorporate the intent of the discussion today, which is clarification.
I guess, Ann, that's right, except I think why they are refining it, or are you thinking it won't even go out until it's refined? I was thinking we were going to go ahead and shoot it out the door before it's refined, and if that's the case, we're going to put this statement in there under further review.
No.
If we're going to sit on it until it's refined, then I agree with your motion.
Yeah, Debbie, I believe that the approval of the FAQ incorporates updating it consistent with the discussion today.
Okay,
So
so it
the
won't go out
approval will
until
be
we,
after
okay,
that has been done.
got it, okay. Does that,
Thank you.
Cheryl, does that make sense
Okay,
to you
members.
too?
Yeah, yes, Debbie, thank you. That did. That helped a lot. Thank you.
And any other member comments? Thank you for the discussion. And we're gonna, so now with a motion and second, we're gonna have to open for public comment. So moderator?
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on this discussion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first comment comes from Stephen Gray. Steve, you may now unmute your line.
Thank you. Just for some help and clarification, in 2017, a letter from the DEA, a public letter posted from the DEA, was forwarded by the National Association of Boards of Pharmacy to all boards of pharmacy. That letter was from the DEA was issued by Lauren T. Miller, Associate Section Chief, Liaison and Policy Section, Diversion Control Division, DEA. And it said, it clarified the DEA policy. It says it represents the DEA policy, and then it says the following: as posted in the preambles of the Notice of Public Rulemaking and the Interim Final Rule, an unfilled original electronic prescription for a controlled substance can be forwarded from one DEA registered retail pharmacy to another DEA registered retail pharmacy, comma, and this includes Schedule II controlled substances. So that may be where to look for something published by the DEA that interprets their own regulations and therefore can be relied upon to answer this question, to clarify it, and be relied upon by the Florida Pharmacy. Thank you for the opportunity to comment.
Thank you. And with that being our only request for comment, would you like me to close the panel?
Yes, please. Oh, sorry. Go ahead.
We're gonna take a roll call. So let me start with Maria Serpa. Maria votes yes. Jig Patel?
Yes.
Thank you, Jig. Jig votes yes. Cheryl Butler?
Yes.
Thank you, Cheryl. Cheryl votes yes. Jose?
Yes.
Thank you, Jose. Jose votes yes. Shirley Kim? Shirley back?
Yes.
Thank you, Shirley. Do you vote yes? Yes. Okay, Shirley votes yes. Ricardo Sanchez?
I'm sorry, I vote yes.
Thank you, Ricardo. Ricardo votes yes. Nicole Thibault? Thank you, Nicole. Nicole votes yes. Debbie Veal?
Yes.
Thank you, Debbie. Debbie votes yes. Jason Wise?
Yes.
Thank you, Jason. And I vote yes. Motion passes. Ricardo, I believe that concludes your committee report. Any other items to discuss for you?
I still have another item here, Sung.
Okay, go ahead, Ricardo.
All right, since we're done with that, I'll move on to item D, update on communication and public education activities by staff. This is pretty brief, so I'll go through all three of these items first and then ask the board for comments and public comments. First, the script. Staff is working on articles and disciplinary case summaries for the next issue of the script. Publication is planned for August 2021. Number two is a staff outreach. Staff provided CE training for pharmacists on prescription drug abuse and diversion on May 19th, 2021 via WebEx. About 600 registrants participated. In addition, the executive officer gave 2 presentations on pharmacy law listed in the committee report. Number 3 is the media, news media. Staff responded to news media inquiries listed in your attachment 4. And then this concludes the section of this agenda. Any board member comments? Hearing none, moderator, can you open it up for public comments?
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this last item for this committee report, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. And seeing no requests, would you like me to close the panel?
Yes, please.
Thank you, Ricardo. That
I was gonna say thank you.
your committee
This
report, I
completes the
believe.
report.
Yep.
Yes, it does. Thank you.
Thank you. Appreciate it. Thank you all for your hard work and the committee members. Really appreciate your time. We're moving on to agenda item number 7, Enforcement and Compounding Committee. I will now turn the meeting over to Maria, Chairperson of the Enforcement and Compounding Committee, to provide a report on behalf of the committee. Maria, the floor is yours.
I just would like to review a summary of the committee's work from its July 15th meeting. The materials in the meeting materials cover the details. The first item is presentation and discussion of the board's inspection program. On an annual basis, our committee receives a presentation on the board's inspection program. Included in the materials is a copy of the presentation slides for the presentation we received during our meeting that was on July 15th. A webcast is also available if anyone would like to hear the presentation. The committee noted that about 25% of our board's licensed pharmacies receive routine inspections during the last fiscal year. We also commended staff for their great efforts to focus on pharmacies that have never received a routine inspection, and noted that progress was made to meet the board's policy goal of conducting routine inspections of all pharmacies at least every 4 years. As I mentioned during the committee meeting, the board does have also an educational pamphlet for preparing for board inspections on its website, as well as a video on how to prepare for the Board of Pharmacy inspection. These are excellent tools to review periodically. Committee members, do you have anything else to add? If not, I would like to ask the members of the board if they have any comments or questions. Hearing none, I think we're ready for public comment.
We've opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists.
Okay, I don't see any public comment. Let's move on and close public comment.
Okay, I will do.
Thank you. Item B, presentation on discussion of board citation and fine program. During our committee meeting, we also received a presentation on the board's citation and fine program. Included in the meeting materials is historical information, including citations issued, orders of abatements issued, and fines collected, as well as presentation slides. The presentation itself can be viewed as a part of the webcast from our meeting. Committee members, do you have anything else to add? Hearing none, members of the board, do you have any questions or comments? Okay, let's open up to public comment.
This is the moderator. We've again opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists.
Not seeing any public comment, I think we can close it.
Will do.
Thank you. Move on to item C, discussion and consideration of pre-filing settlement conference. Members, as you recall, during the April board meeting, we considered an alternative case resolution proposal that could be implemented to reduce the time and cost associated with resolving a disciplinary matter. This was the last step of a 3-year-long process to look at an alternative enforcement model. This was requested by members of the public. In April, the board expressed support for establishing a pre-accusation conference as a means of achieving this goal. As you may recall, a similar model is currently used by the California Board of Accountancy. Since our last meeting, staff and representatives of the Office of the Attorney General have worked further to develop a general implementation plan as well as flow chart that demonstrates what the process could look like. Our committee considered a flow chart that is included in the meeting materials and is also displayed on this slide. The slide appears to be a little bit small, so it is in your meeting materials. This is the flow chart for the pre-accusation conference portion. There is also a flow chart for the entire disciplinary or case resolution process. As proposed, the pre-filing conference model would be used initially through cases assigned to the board's 2 assigned deputy attorney generals. You could leave the flow chart up, thank you. The DAGs would work with the board staff to identify cases appropriate for this model. As a summary of the discussion from our meeting is included in the chair's report, I wanted to highlight that the committee's discussion focused solely on the development of a pre-filing conference consistent on the direction that the board has given us. Subsequent to the committee meeting, written comments were received by CPHA, which were also provided to members. These comments were provided to the committee verbally during the enforcement committee meeting. Before I open discussion to other members of the committee, I believe it's important to note that participation in the proposed pre-filing conference is not mandatory, but solely included as an alternative option as requested by members of the public. Committee members, is there anything you'd like to add before I offer our recommendation?
Maria, I'd like to add a couple comments if you would be okay with it.
Sure, go ahead.
I thought I'm a newer member on this committee. I haven't lived through all the different variations of the possible pre-filling case solutions that have been discussed, but I've read through all the minutes, and I thought that this really does a great job. Nothing's perfect, but this comes pretty close to getting to what was originally requested. And what was originally requested was that if someone feels like there's going to be a case filed against them, that they can provide additional information before it actually, before the case is actually filed. Thus, averting the need for additional time, possibly averting the need for legal representation. And I think that this model really fills the need. Like I said, nothing's perfect, but it could create a situation where perhaps the additional information would change what's filed, or potentially even it could be a situation where maybe something won't be filed. But for sure, it provides our licensees an opportunity to provide that additional information that they feel in the past wasn't they were not given the opportunity to present, which would significantly impact their case. So I think Maria's been a great committee chair in leading us very meticulously through this program and through other options. So I just think that the committee has done a great job at looking at this and listening to the public, and I think this is the answer based on the other models that we've seen. So thank you for letting me share my thoughts.
Thank you, Debbie. Any other comments from committee members? Hearing none, how about board members? Do you have any questions or comments to me as the chair or to the committee?
Trying to understand why why this feeling of it being more detrimental to licensees when you say that they still have the other option.
I think that you may hear more during public comment regarding some opinions. Again, this is an option. It's not required. It's an alternative option. The other flow of the disciplinary or case process is regulatorily required and not changing. So this is just an additional level that gives one more chance for the individual to speak to the issue before the case is filed.
Okay. All right.
Yeah, thank you.
Thank you.
Any other questions from board members? Okay, before we open up to members of the public, just want to remind you that we're only speaking on the issue at hand on the agenda, which is the pre-filing settlement conference and the flow chart. Go ahead and open to public comment.
This is the recommendation. Excuse me, Dr. Sturt, but this is Eileen, but doesn't the committee have a rec that they want to make to the board, that they're making?
Oh, I'm sorry. You're correct. I should state the motion. This is a committee motion. The committee is recommending approval of the finalized flow chart and direction for staff and the Attorney General's office to implement this process.
I'll second that. This is Jake.
Thank you, Jed. And thank you, Eileen and Ann, for reminding me to actually state a motion. Members, I apologize. I asked you for your comments before the motion. Do you have any other further comments on the motion? Okay, and now we're ready for public comment on the motion as was stated on the screen just a moment ago.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on the proposed motion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Our first comment comes from Danny Martinez. Danny, you may now unmute your line.
Martinez with the California. I appreciate the comments and appreciate the committee's work on this issue. As I mentioned in our letter to the board, this has been worked on for several years now. The position that we're taking is we would like the board to just table this discussion for now, and mainly because of what we've written at the end of the letter, where the board is going to at some point be discussing the move to a standard of care model for pharmacy, where the current laws and regulations on enforcement are going to have to essentially be rewritten anyway to adhere to that. And as I mentioned in the letter, the original purpose of this, of why we brought this forth in the first place, was to try and avoid involving the Attorney General. Now, as I mentioned during the committee meeting, we do know and we understand that there are laws, specific laws, that have to incorporate the Attorney General. And we were hopeful that the board would find a way to not involve the Attorney General and not have to change either statute or regulations to do so. But it's pretty clear now that that's not possible. And so the whole purpose of this is to do that. And this flow chart and this work doesn't advance that at all. And so there was a question, I believe, from one of the board members, Cheryl Butler, about why this makes it worse. Well, right now under the APA, you are afforded certain rights, and the intent of this model is to be more expedient, but the expediency comes at the cost of giving up your rights as an accused. You're essentially, in essence, admitting guilt, again, without having the opportunity to give any sort of evidence that might be contrary.
10 seconds.
So with that, I would ask respectfully that we just table this conversation for now and address this as the board discusses the standard of care transition through the censored review bill. Thank you.
Thank you, Mr. Martinez. So
Our
what
next- Go
just
ahead.
to clarify, I think what you're saying is for us to not move forward and to maintain the current process is what the recommendation that you have from CPHA.
Yes, that is correct.
Thank you.
Mhm.
Is there further public comment?
Yes, our next comment comes from Joe. Joe, you may unmute your line.
Is this, although it's a good step in the right direction, the problem is one small problem is when you want to tell your side of the story, from what we hear, it's not clear who you're talking to. If you're talking to the Attorney General, that is completely unfair. It's unbiased. And to be honest with you, the Attorney General does not have a degree in pharmacy, never worked in a pharmacy, doesn't know the pressures of working in a pharmacy, does not have any training in compounding. And to be honest with you, they're really not qualified to be able to answer these questions. You really need someone who is a professional, a pharmacist, to speak to. The being able to talk to Attorney General, they have one mission, it's to prosecute. And I think this is that they should not be in this at all. And if you look at the standard of care on top of it, they definitely shouldn't be involved in it. That means you should have professionals. You know, if this was happening to you, would you not want to be judged by your own peers, even if you're not a pharmacist? Because pharmacy is very complicated. And so you should be able to, like most boards and the medical board, speak between 2 or 3, probably 3 board members, and they should be pharmacists, but other board members can be there. But to speak to the Attorney General, it's really a waste of time because their job is to prosecute you, and they're not going to back down. That's just the way it is. You need to speak to someone, very least, to be a board member, or should I say, a working for a staff, such as Christine, if you're going to be talking about compounding, someone who's very knowledgeable. Because honestly, sometimes you're just talking over people's heads. They just don't understand.
10 seconds.
A lot of these sometimes are administrative violations and people are getting prosecuted and revoked. And do they really deserve that? And I think pharmacists should look at that before sending it to the Attorney General. Thanks.
Thank you, Mr. Grisella. And just to clarify for board members and for the public, the pre-filing conference model that is on the flow chart and being suggested is just that, a pre-filing conference, a discussion with the DAG assigned to the case and staff members appropriate to the case, and that includes pharmacists. Licensed pharmacists are on the staff of the board. Any other public comment?
Yes, our next comment comes from Stephen Gray. Steve, you may unmute your line.
Thank you. I also support the tabling of this for further discussion for a variety of reasons. Yes, there's been a lot of discussion about this. It's a very complicated matter. There's been a lot of changes in the members of the Board of Pharmacy. I doubt that the current members of the Board of Pharmacy fully understand everything that's involved. I also hear the frustration in the chair's voice about this going on. She just made a statement that was not clarified in the committee meeting, that the pre-filing conference shown in the second yellow box on the flow chart would include staff and pharmacists. At the committee meeting, there was a discussion about before it goes to the Attorney General's office, the first blue box, there goes through an investigation process. It was described as an iterative process with back and forth. But there was no discussion that there was an opportunity for an in-person conference, even at the investigation level, which is part of what I think one of the commenters was talking about. In the second yellow box where it says pre-filing conference that the chair said would have staff and pharmacists present, there is no arrow going out to the side that says that one of the conclusions can be sent back to the board for investigation. When you compare this flow chart with the general case process, it still leaves it up to the Attorney General's office whether there is even a pre-filing conference at all. It says no, and then it goes through the general case process, which is out to the side. There may be times when that is appropriate, but this flow chart does not address what was asked for originally and what has been discussed. I recommend that if nothing else, the flow chart needs to be amended so that people will understand what the process really is. And this flow chart is not complete, and even what was discussed today. So I recommend that it be tabled or reconsidered, go back to the board at a later time when there can be a discussion about this rather than just 2-minute comments. Thanks.
Thank you, Dr. Gray. Any other public comment?
No other requests at this time. Would you like me to close the panel?
Yes, thank you. So members, we're ready for a vote. I'd like to turn it over to the president to vote on the pre-filing conference flowchart and model as discussed by the committee and the board in previous meetings.
We're going to go for with a committee recommendation and public comment. So we're going to go for a vote. We'll start with Jig Patel.
Yes.
Jig? How do you vote? Yes. Thank you, Jig. Jig votes yes. Cheryl Butler?
Based on the comments, my vote is no.
Thank you, Cheryl. Cheryl votes no. Jose?
Based on the comments as well, my vote is no.
Thank you, Jose. Jose votes no. Shirley Kim? Thank you, Shirley. Shirley votes no. Ricardo Sanchez? Thank you, Ricardo. Ricardo votes no. Nicole Thibault?
I will abstain.
Thank you, Nicole. Nicole abstains. Debbie Veal? Thank you, Debbie. Debbie votes yes. Jason Wise? Jason?
No.
Jason votes no. Thank you, Jason. Maria?
Yes.
Maria votes yes. There is 3 no, and there is 5 no, 1 abstain, and I will vote no. So the motion fails. I will bring it back to you, Maria.
Thank you. So the issue is closed. Next item on the agenda is D, discussion and consideration of board's disciplinary guidelines. Members, as included in the meeting materials, the board's disciplinary guidelines are incorporated by reference into the board's regulation. The board provides guidelines for those involved and affected by disciplinary process, including general public, attorneys for the Office of the Attorney General, administrative law judges from the Office of Administrative Hearings, defense attorneys, courts, board staff, and board members. The board provides that the guidelines are to be followed in disciplinary actions, noted that individual cases may necessitate a departure of the guidelines, noting in such cases the mitigating or aggravating circumstances can be detailed in any proposed decision transmittal memo accompanying a proposed stipulation. I apologize that is a difficult comment to understand, but it is in the meeting materials if you want to read it. Of course, it's all pretty much legal language. During the April 2021 board meeting, it was recommended that the board consider the current provisions as it relates to underlying actions involving driving under the influence convictions. However, given that the current guidelines were previously adopted in February 2017, it may be appropriate to determine if a broader review should be considered. During our committee meeting, we discussed several questions detailed in the chair report. As discussed during the meeting, any changes that are recommended to the disciplinary guidelines must ultimately be made through the regulation process. As a committee, we determined that the next step in our review of the disciplinary guidelines will be for staff to identify recommended changes and to coordinate with me the scheduling of a separate meeting to discuss the recommendations. It is the committee's preference for an in-person meeting should the conditions make such a meeting possible. However, we will proceed with a meeting if WebEx is necessary. Committee members, do you have anything to add? How about board members? Do you have any questions or comments to the committee on its next steps? Okay, I think we're ready for public comment.
As the moderator, we've opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists. Our first comment comes from Joe. Joe, you may unmute.
I believe that we should take a look at all the guidelines. And for one, that's a major problem is if you look at the first level of enforcement, it actually says any improper compounding. It's not clear at all what that means. It could be the minor violation, and you can get your license revoked, stayed, and placed on probation. And it's not clear. If you're going to go that far, revoke and put someone on probation, it really should be something very serious. It is not explained. This is the same wording that's been there since 1990. It needs to be looked at. It should not be for any minor violation, because if that happens, I could only imagine pretty much every single pharmacy has a problem, including hospital pharmacies. And I think that should be discussed. And there's also a disciplinary action that I don't even see listed, which is one step weaker, and that is a letter of reproof. And that should be at least mentioned as a possibility before we go into revocation and probation. Revocation, probation causes a tremendous amount of collateral damage, irreversible damage to the reputation, possibly shutting down the pharmacy and people losing their jobs. And it could be for a minor administrative violation, just like it says, for compounding. So I think it all should be reviewed. Thank you.
Thank you, Mr. Grisella. I hope you're able to make our meeting where we discuss this in depth. Thank you.
And seeing no additional requests for comment, would you like me to close the panel?
Please do. Thank you. Next item on the agenda is discussion and consideration of authority for pharmacists to furnish naloxone, including California Code of Regulations, Section 1746.3, Protocol for Pharmacists Furnishing Naloxone Hydrochloride. Members, our next item for discussion related to the pharmacist authority for furnishing naloxone, including the protocol established in regulation. During our committee meeting, members discussed several questions that are detailed in the chair report. I think somebody needs to go on mute. We have a little bit of background noise. Thank you. After consideration, the committee determined that evaluation of the protocol should be considered as a part of the standard of care work group that is in AB 1533 currently in the legislature. We also received significant public comment, including comments from Dr. Gaspar, who is a psychiatric pharmacist with subspecialties in addiction medicine. Dr. Gaspar suggested that in his opinion, issues such as stigma within the profession may prevent pharmacists from participating in the protocol and may not be related to the perceived barriers within the existing protocol. The committee believes it may be appropriate for the Communication and Public Education Committee to develop educational materials to help focus on the steps that can be done to increase pharmacists' participation. The committee also received comments suggesting that the issue is urgent and that the board should act now and not wait for the standard of care work group to consider the matter. Committee members, is there anything else that you'd like to add? How about board members? Do you have any questions or comments for the committee? Okay, let's go to public comment.
This is the moderator. We begin open the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first comment comes from Stephen Gray. Steve, you may unmute your line.
Thank you again. I was the one at the committee meeting that said this is an urgent matter, and I want to emphasize to the full board just how urgent this is. Last week, there was published a post-COVID pandemic statement that the deaths from opioid overdose have increased 29% per year over pre-pandemic measures. A lot of that is maybe be related to the pandemic. It may be related to shortages in supplies where people are using drugs that are dangerous, such as the chemical variants of fentanyl and so forth. But I think before the board goes any further and decides to delay this, it needs to find out how many pharmacies of its 6,000 pharmacies in California are actually participating in the naloxone furnishing that the law that was changed in 2013 gave them the ability to do. I again contend that the complication of the pharmacy protocol is a major factor in why they are not participating. And things have changed. There have been national calls for naloxone to be made OTC, since it is not a drug of abuse, but can save lives. Actually, when you find out that these pharmacies, some of them that have 600-700 pharmacies or 300 or 400 pharmacies, they respond back that they very rarely provide it in any of the pharmacies, and even those pharmacies, it's very rarely provided. So something is wrong when you enacted a law that was intended to save lives through the provision by pharmacists of a life-saving product, a life-saving product that is covered by many insurances, that needs to be in the hands of people, that many non-healthcare providers can provide much easier than pharmacists can provide.
10 seconds.
And so I believe the board needs to find out the actual statistics before it delays this any further. Thank you.
Thank you, Dr. Gray. And I just wanted to state that the committee did hear your comments, and that is one of the reasons why we are urgently asking for educational materials to be sent out to the licensed public so that we can increase participation in the naloxone program.
Seeing no further requests for comment, would you like me to close the panel?
Please do. So members, we do not have a motion on the table at this point. Currently, the committee is suggesting urgent education to the licensed public on increasing pharmacist participation. Any other member comment? Okay, hearing none, let's move on to the next item. Oh, I was waiting for the slides, and there they are. They're right there for me. Discussion and consideration of draft FAQs related to regulations governing automated drug delivery systems. Provided in attachment 4 are a draft frequently asked questions document related to automated drug delivery systems. During our meeting, members generally agreed with the questions and answers and requested that staff make revisions to question 21 related to the use of ADDS used to dispense up to a 72-hour supply of drugs to a patient that is being discharged from an emergency room when the hospital pharmacy is closed. Those changes are made in the documentation you have in the meeting materials. Also, as indicated in the chair report, The committee did receive public comment indicating concern with the ADDS registration requirement when used for discharge in the scenario I just described above. So there was a question whether they should have those ADDSs registered or not, and our legal opinion was that that was required and the FAQs were correct. So as a reminder, I have reviewed the FAQs along with board staff, and we updated question 21 to meet the needs of the committee as discussed. So that's what's in the meeting materials. Committee members, do you have any additional comments before I offer our recommendation? So let me do the motion first this time. Members, for your consideration, the committee recommends approval of the FAQs as updated. This is a committee motion, so no second is required. Members, do you have any comments? Hearing none, I think we're ready for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this motion, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first comment comes from John Gray. John, you may open your line.
Thank you. Good morning again, or afternoon now. I'm John Gray. I'm a registered pharmacist with Kaiser Permanente. And first, again, I want to thank this committee for drafting these FAQs. I think they do a great job of addressing the majority or a number of potential questions related to the use of ADDS devices. Also want to apologize for not getting these this comment to the committee during the committee's meeting. It was some new feedback that we got from some of our colleagues since the committee's meeting. We do have one suggestion for the board to consider related to the requirement to submit records of quality assurance reviews for medication errors related to the use of an ADDS. We believe that it might be a benefit for the board to provide direction to licensees on how QA review records should be submitted to the board. One way to accomplish this might be a Board of Pharmacy email inbox that is dedicated to ADDS QA report submission, or the already existing ADDS@dca.ca.gov email address. All we're suggesting is it would be good to let licensees know how they ought to submit QA reports to the board. Recognize the board may wish to finalize these FAQs and get that information out later by another venue, but that would be of value from our perspective. Thank you again for putting this document together and for the opportunity to provide our thoughts.
Thank you very much. I believe that is an excellent comment. I think we will have a chance to discuss that a little bit more during the Ledger Edge report, where the actual regulation is changing and requiring the QA portion of it. At that point, how that is operationalized will probably be determined by board staff, and information will go out to the licensees about how to operationalize the required reporting of QA for ADDSs. At this point, I don't think that's been operationalized, and so it's not ready for the FAQs. So I leave that up to board members if you'd like to postpone the release of the FAQs until operational board staff, maybe Anne can respond to it, how staff is going to require that. Or I would suggest that we just move ahead with the FAQs as written, and as new information is available, that can be advertised to the licensees and potentially added to the FAQs. Anne, do you have any other comments about that? Anne?
That we move forward with the FAQs. People are always welcome to submit additional suggestions on additional FAQs, but in terms of releasing, it feels like now is a good time to release. And then as the landscape changes, additional considerations can be made to the FAQ.
Thank you. Board members, did you have any questions about?
I don't think, have we heard from all the public commenters yet?
You're correct. We haven't finished public comment. Is there additional public comment?
No additional requests received.
I must have ESP. I knew that. So public comment is closed. So now we're ready. Now we're ready for board members. Did you have any additional comments on the committee's motion? And the committee's motion is to approve the FAQs as submitted for release. If no changes, I turn it over to the president for a vote.
Thank you, Maria. We are going to take a roll call. We're going to start with Shara Butler.
Yes, I support.
Shara votes yes. Jose? Thank you, Jose. Jose votes yes. Shirley Kim?
Yes.
Thank you, Shirley. Shirley votes yes. Ricardo Sanchez? Thank you, Ricardo. Nicole Thibault? Thank you, Nicole. Debbie Veal?
Yes.
Thank you, Debbie. Debbie votes yes. Jason Wise? Thank you, Jason. Jason votes yes. Maria?
Yes.
Thank you, Maria. Maria votes yes. Jig Patel? Thank you, Jig. I vote yes. The motion passes unanimously. Maria, I will hand it back to you, but I believe that is your last committee report. But
one last little statement for item G. Review and discussion of enforcement statistics. Attachment 5 includes the enforcement statistics for the fiscal year as well as a 3-year comparison. Members, do you have any question on the statistics as referenced in the chair report? Hearing none, I think we're ready for public comment.
This is the moderator. We've opened the Q&A panel again. If you'd like to make a comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to our panelists.
Okay, seeing no comment, I think we can close.
Will do.
Mr. President, that concludes the report of the Enforcement and Compounding Committee. Thank you.
thank you, Maria. Thank you all the committee members and chair for hard work on the committee. And it is 12:06. We are going to take a lunch break if it is okay with all the members. I would say we will be back about 45 minutes. So 12:51, if that's okay with everybody. I believe Shirley. Sure, that's fine. 107 is fine, Cheryl. Let's do 107, and I believe Shirley has to step away as well. So, Shirley, just let us know when you come back.
Thank you.
Thank you, guys.
Thank you.
We'll see you at 1.
Thank you.